Welcome to Logical Ayurveda. Today we are going to see about Malathyadi Tailam. Last video we discussed in detail about Neelabringadi Tailam. So today we are going to see in detail about Malathyadi Tailam. So last video we also discussed about importance of choosing the taila according to the dosha and according to the prakriti vikriti of the patient and not depending on like choosing a single taila or one size fits all prescription for everyone. So in this video we'll find out how unique is Malathyadi Tailam and what its applications are and where exactly it will be suitable for prescribing this Tailam. Now Malathyadi Tailam has 4 ingredients: Malathi, Jasminum grandiflorum, Naktamla, it is also called as Karanja, and it is called Pongamia pinnata, which is known by the famous drug of Punga in Tamil, and Karavira, Nerium indicum, Agni, Chitraka or Plumbago xylonicum. So it contains 1, 2, 3, 4, out of which 3 are Ushna. This Taila action is considered to be Ushna, Kafahara, Kafavilayana, increases Pitta, promotes hair growth. Now, where this should be used and where this should not be used. 1. It is exclusively, uniquely and preferably used in Alopecia aerata or Indraluptha. Why it is exclusively used in Indraluptha? Because it is containing all the Ushna Dravyas, all the Lekhana Dravyas which are useful in hair growth regeneration for the patient of Indraluptha. Where Indraluptha, different acharyas have different opinions, but in common practice, in general practice, at least in my clinical practice, I found out that it is very kaphaja in nature. Internal medicine may vary on the doshas, but external medicine should be always given as Ushna. So that is why we have the Indraluptha Mashi there. So for the patient of Indraluptha or Alopecia aerata, I make sure that Kapha is involved and Pitta is not involved by following a series of questionnaire that Pitta is not involved and Kapha is only involved. Like patient's history or patient's Nidana will be having, they will be very lethargic, they will be having cholesterol rich foods, they won't be following any exercise and they will be inside their homes only, and they will do all the kapha promoting activities that ends up in them having alopecia aerata, and they will have madhura aharas etc., and they will have oily foods. So even for alopecia aerata in Siddha medicine, it is called, in Tamil it is called Puluvettu. Pulu means worms. They are telling that alopecia aerata particular disease is completely caused by kaphaja krimis. So why krimis getting increased? Because of kapha, tila, guda, jaggery and sugar, on all those activities that increases kapha, causes kaphaja krimis, which goes and sits there in the scalp, causing the Indraluptha or Alopecia aerata. So the external application should be always Ushna. Indraluptha Mushi gives excellent results in Alopecia aerata. So what we do, either there are 2 things that I do. One, first scrubbing of Indraluptha Mashi on the Alopecia aerata side, followed by the application of Malathyadi Tailam. Or I will ask both to mix, both Indraluptha Mashi and Malathyadi Tailam mixed, and I will prescribe to the patient for external usage. Now, I prefer always using Malathyadi Tailam instead of Malathyadi Kera Tailam. That is Tila Taila as a base instead of Kera Taila. Why? We need Ushna here. So we need Tila Taila than Kera Taila. In active disease phase, for curing, always use Malathyadi Tila Tailam, and after you cure the disease, for maintenance you can give Kera Taila. Okay, so simple Tila Taila and Kera Taila usage is also based on doshas, and you cannot go on randomly selecting Kera Taila and Tila Taila for different patients. So where else this can be used? It has excellent results in Alopecia aerata that we have discussed. Many patients of Kaphaja Nidanas, Kaphaja Ahara Viharas and Kaphaja Dushti come. Okay, for such patients like, sir, I have reduced density of hair. I used to have more density of hair before, but now I do not have that density, but I have no other problem associated. I do not have any psoriasis or itching or anything associated, but my density is very, very low. How to improve this density? In such cases, you can prescribe Malathyadi Tailam, or if you want, if it is very mild in nature, you can also prescribe Malathyadi Kera Tailam instead of Tira Tailam. So in such condition, it will increase the density of the hair, but you should make sure that the pitta is not involved. How can you understand that pitta is involved? Excessive itching should not be there, or flaky psoriasis should not be there, burning sensation should not be there. So for such a questionnaire should be prepared, and make sure that pitta is not involved. For such patients it can be used. One, not only external preparation, for internal preparation also, internal medicine also I give for curing alopecia areata. Mostly I give Narasimham tablet of Sitaram company, which contains all the Kafahara medicines. That is excellent in promoting the hair growth. And I also give Guglu Tiktaka Kashaya or Guglu Tiktaka Grita. Guglu Tiktakam is very hot in nature, so it promotes hair growth also. Tikta is Asti Vardhana and Kesha Vardhana. So I prescribe Guglu Tiktaka Kashaya or Guglu Tiktaka Grita. Similar tailas of Malathyadi are, we also discussed similar taila of Neelibringadi or Kuntalakanti tailam and Kayunyadi tailam, but similar taila of Malathyadi are Durdurapatradi tailam. Durdurapatradi tailam contains Datura as a main ingredient, but I do not mix Durdurapatradi with Malathyadi because I find Durdurapatradi is very effective. Its Prabhava is very good in dandruff and mild itching. When the patient say I have dandruff along with very mild itching, then I prefer Durdurapatradi because it's excellent in reducing. So this is all about Malathyadi Tailam and how to use in a particular condition of Malathyadi Tailam.